All right. My name is Amber. I'm a student at South University in Savannah. I will be doing a physical exam on you. Is that okay today?
Yes.
Yes. All right. I have washed my hands. This is a 29-year-old male. He is well appearing, well dressed. He does not have any signs of distress. Let's see. Can you tell me your name and date of birth?
Michael Wingate, June 10th, 1996.
Okay. What year is it?
2025.
All right. And who's the president?
Donald Trump.
All right. This patient is alert and oriented times 3. His blood pressure was 120/65 with a heart rate of 62. Temperature 98.4. Oxygen is 95% on room air. He has 18 respirations. With even and unlabored respirations. First, we are going to inspect the scalp. There is even distribution of the scalp, of the hair. There is no lesions noted, no redness, no dry skin. His skin here it's warm, dry, and intact. There's no lesions, no bruises, no marks there either. Is there any tenderness?
No.
Good. There is no tenderness to the head area. Let's see. Next, we're going to palpate the temporal pulses bilaterally. Temporal pulses are intact. They are +2 bilaterally. Next, we are going to assess the TMJ for tenderness. If you would, open your mouth, clench your teeth. Any pain?
No.
All right, no pain to the TMJ noted. Next, we are going to go on and assess cranial nerve 7. If you would, smile, raise your eyebrows, poke your cheeks out. Very good. He has symmetrical facial features there, which is a normal finding. Next, we're going to assess sensations, sharp or dull, okay?
Sharp. Dull. Sharp.
Okay, so sensations are intact, which is also a normal finding here. Next, we are going to go on to the eyes. Here we've already done the visual acuity using the Snellen chart. Basically, the patient stands 30 feet from the chart and they read the smallest letter. In this case, this patient's visual acuity is 20/20 here, which is a normal finding. Next, we are going to we're going to check the peripheral vision by confrontation. If you would tell me which finger, left or right?
Left. Right. Left.
So this patient's peripheral and confrontation is normal for this assessment. Next, we are going to go on to assess the eyes and do the 6 cardinal fields of gaze. If you would, follow my finger with just your eyes. All right, so the 6 cardinal fields are good. There is no nystagmus noted. Conjunctiva is clear and white. Pupils are 4 millimeters and brown and brisk. Next, we are going to shine a light. Yeah, pupils are 4 millimeters. They're brisk. Reactive to light, red reflex is intact, which is also a normal finding. Next, we're going to go ahead and inspect the outer ears. Outer ears look good. There is no redness, no swelling, no drainage noted to either outer ear. We're going to do the whispered voice test. I'm going to whisper something in each ear and you're going to tell me what I say.
2. 4.
4. All right, good. So his hearing is intact. Next, we would do the Weber and Rhine test. The Weber test for lateralization of sound, so we would put a tuning fork to the front of the forehead and sound would be lateralized bilaterally, which is a normal finding. And in the Rhine test, we would put one to the mastoid process, which checks for bone conduction, air conduction. Next, we're going to take a look at the ears. All right, very good. Okay. The tympanic membrane is pearl. There is no redness to the internal ear structures, which is a normal finding. No signs of otitis media or anything. Next, we are going to inspect the nose for patency. I'm going to take a look. Very good. There is no polyps, no drainage, no redness noted to the nose. Next, we are going to palpate the frontal and maxillary sinuses. Any pain or tenderness?
No.
Any pain or tenderness?
No.
No, this patient does not have any pain or tenderness to their sinus cavity right now, which is a normal finding. Next, I'm going to put on my gloves and we're going to inspect the oral cavity, okay? All right, very good. All right, no dental caries, oropharynx, there's no redness to the pharynx. Uvula is midline, no hyperplasia, no dental abnormalities noted, no oral lesions, oral mucosa is intact, tongue is not swollen, there is no edema there. Tonsils are also present for this patient. There is no swelling or redness or exudate noted on the tonsils. Next, we are going to have the patient stick their tongue out. All right, and up, down, sideways. This is symmetrical movement, which is a normal finding for this patient. Let's see. Next, if you would, bend your neck down. We're going to check for range of motion to the side. Any pain or tenderness?
No. No.
Good, all right. Next, we are going to assess the cervical nose. All right. You got your pre-auricle here, post-auricle, submental, submandibular, tonsillar, superficial cervical, posterior cervical, occipital. All right, and next and they're normal. There's no enlargement. Next, we're going to assess the thyroid. If you would, bend your neck down and swallow for me. Any pain or tenderness?
No.
All right. The thyroid is normal. There's no nodules, no swelling, nothing abnormal there, and no pain or tenderness too. Next, we will go on to the shoulders and upper extremities. We're going to check the axillary lymph nodes. Okay. The axillary lymph nodes are not enlarged. They are fine. Lateral, pectoral, and central. Those are all normal. Next, we are going to inspect the shoulders and clavicle for symmetry. The shoulders look good and symmetrical. Clavicles are nice and symmetrical. Is there any tenderness to this area? Any tenderness?
No.
No tenderness noted to the shoulders or clavicle area. Next, we're going to assess the range of motion of the shoulders. If you would, move your shoulders forward, backward. Any pain or tenderness?
No.
Good. No pain or tenderness to the shoulders, which is a normal finding. All right. If you would, shrug your shoulders. Good, good. That's normal as well. Next, we are going to inspect the elbows here. Is there any pain or tenderness?
No.
Good. There's no pain or tenderness on palpation. Visually, there is no swelling, redness noted, or no deformity noted to the elbows. Next, we are going to go on to assessing the brachial and radial arteries. Right here, we'll check the brachial. They're +2 bilaterally and brisk, which is normal finding, and then the radial here, They are symmetrical, equal, +2, and brisk bilateral as well. Let's see. Next, we are going to start assessing the chest. The patient's chest, he has normal AP diameter, which is normal for him. There is no bruises, lesions, deformities noted to the chest wall. We're going to palpate the carotid arteries. We take a listen. There is no bruisings noted. Next, we will go on to listening to the heart. This is the aortic, pulmonic, tricuspid, and mitral valves. There is no bruise or added sounds there. S1 and S2 is present. There is no S3 or S4, no gallop. Let's see. The cardiac rhythm is normal. Let's see. Next, we're going to take a listen to the lung sounds here. We're going to go on to the chest. This is going to be checking for tactile dermatitis. Say 99.
99. 99.
There is no tactile dermatitis present. We'll go ahead and check for ecphony as well. Let's see. Say E.
E. E.
Good. All right. There is no ecphony or bronchophony present either. Any pain or tenderness?
No.
All right. Next, we'll go ahead and listen to the breath sounds here. Deep breath. All right. There is no reason crackles, which is good. Let's see. Next, we're going to do percussion to check. All right. There is no dullness or hyperresonant. Resonance would be the normal finding here. Next, we are going to go on and inspect the abdomen. If you would, go ahead and lie down for me. All right. First, we'll start by inspection. There is no deformity, no striations, no swelling noted, no edema noted, no bruising. Next, we are going to go ahead and auscultate bowel sounds in all 4 quadrants. Bowel sounds are normal there for him. Next, we are going to go on and, let's see, listen for the abdominal aorta. Okay. Next, we are going to go ahead and percuss the abdomen in all 4 quadrants. Okay, we can feel the liver's edge there. Let's see. Normal percussion in all 4 quadrants is expected and seen in this patient. Let's see. All right, that we checked for spleen. No enlarged spleen is noted. Let's see. Next, we're going to palpate all 4 quadrants. And tell me if there's any pain or tenderness.
No.
No pain or tenderness.
No.
Okay. That was light palpation. We're going to do some deep palpation now. No pain, no tenderness.
No.
Any rebound tenderness? Do you feel pain on the other side when I press down?
No.
All right, very good. So that's also a normal finding. Let's see. Next, we're going to do the psoas sign and obturator sign. These check for things like appendicitis. We're going to have you bring your leg up. Any pain?
No.
Very good. Bring it up again and twist. No pain or tenderness?
No.
Good, no pain or tenderness noted either. All right, let's see. Next, we are going to, I'm going to palpate the bladder. The bladder is not distended, which is a good thing. Next, we'll go ahead and check for CVA tenderness. We'll have the patient sit up. Here. And we'll take my fist and a closed fist and hit the lower back on each side. Any pain or tenderness?
No.
No CVA tenderness is present, which is also a normal finding. This will check for like bladder or kidney infections. In this case, he has no pain or tenderness there. All right, let's see. All right, next, if you would, lay back down for me. I'm going to go ahead and inspect the hips here. Let's see. All right. The hips are symmetrical. There is no deformity noted. Let's see. Any pain or tenderness?
No.
No pain or tenderness to the hips area, which is also a normal finding. Let's see. All right, if you would, go ahead and stand up for me. And bend down for me. We're going to assess the spine here. All right, spine feels symmetrical. Any pain or tenderness?
No.
No pain or tenderness to the spine. If you would stand up, let's rotate your hips. Any pain or tenderness there?
No.
Very good. Let's see. All right, can you lift your leg up? Any pain, tenderness?
No.
Good, very good. All right, next, let's see if you'll have a seat for me here. We're going to inspect the knees. Let's see. The knees, bilaterally, they're not swollen, no redness or swelling noted. Let's see. Any pain or tenderness with movement?
No.
Pain or tenderness with movement?
No.
Good, no pain or tenderness into the knees is noted. Next, we are going to let's see. We're going to inspect and palpate the feet for any swelling or edema. Let's see. No swelling or edema is noted. No redness. While we're down here, we'll go ahead and palpate some pulses. +2. +2. All right. Pedal pulses are intact. They're good. Next, we will go to we will go ahead and palpate some other pulses. We'll check the popliteal. Very good. +2 here. If you did the femoral, you would be right in the groin areas where you would check for the femoral pulses. All right, now if you would, hold your legs up and push against with your feet. Good, good resistance there. All right, next we are going to go ahead and assess the sensations of the lower extremity. Sharp or dull?
Dull. Sharp. Sharp.
Good. So sensations are intact there also. The strength of the lower extremities is 5 out of 5, which is normal finding. Next, we'll go ahead and assess the biceps deep tendon reflex with a reflex hammer here. We'll do biceps, triceps, brachioradialis, patellar, and Achilles, okay? So this is going to be the bicep. Good. The tricep. Very good. Brachioradialis. Very good. All right. This would be the patella down here. All right, and the Achilles you'd find right back here. Very good. All right. So his deep tendon reflexes are present and normal. Next, we are going to check the plantar response or the Babinski's response. Basically, we would hold the foot up and just rub your hand. You see the curls the toes would curl basically. Next, we will assess stereogenosis. Basically, we'll hand the patient an object. They'll close their eyes and they'll tell me what it is. All right, let's see. All right, close your eyes. What is this?
Pear.
Very good. All right, stereogenosis is normal in this case. Next, we are going to go on to we're going to assess some coordination of the upper extremities. If you would touch your nose, touch my finger, do it quick. Good. So coordination of the upper extremity is intact. It looks good. Next, we are going to assess coordination of the lower extremities. To do some toe point for me. Up, bend your foot. Okay, down. Other one. Very good. Next, we're going to go ahead and have you stand up, and if you would, do heel to toe. Try to walk in a straight line for me, like that. All right, heel to toe looks good. This patient's gait is normal, which is a normal finding. Next, we're going to assess the strength of the upper extremities. If you would, hold your arms straight. Keep them up. Very good. All right, you can put your arms down. Do the same thing. Hold leg up. All right, next leg. All right, very good. Put them down. All right, if you would, squeeze my hands. Very good. All right, strength is plus 3 is very, very good grip strength there. Okay. Next, we are going to do the Romberg test, which is basically where we have the patient stand, they close their eyes, and they hold their arms out. There's no staggering to this. So that is a normal Romberg test right here. Balance looks good, position looks good. You can quit now. All right. And that is it.